like many of you in this room today, but perhaps like fewer of the people who were my classmates, I got to go somewhere else, quite unlike Durham, North Carolina, or Florida, where I'd grown up. And unlike France, where I'd spent maybe 8 months during college, I went to Haiti. And I went to rural Haiti. And, Graham Greene wrote a book called England Made Me. Haiti made me. And I every time I come to BC, I try to underline my debt to Haiti, to that year. I knew I wanted to go into medicine. I had no idea why. Haiti made me know why. I had no idea what kind of doctor I wanted to be because I'd never even been to a doctor. Not really. And Haiti made me know that as well. So the answer about Partners in Health is Haiti. I remember the first year, I think it was the first year I was there, I saw something very terrible, a woman die in childbirth, and spent some time trying to raise money for a blood bank. Of course, I was 23 or 24, and I was hitting up Todd. Let's just say he comes from a different social background than I do, so hitting up his parents was a good idea, lucrative. I thought, just imagine if you had a group of people in the United States and in Haiti working together to address healthcare problems of people facing both poverty and disease. What would it look like? How would it be different from a missionary group? How would it be different from this is before the end of the dictatorship, so there weren't a lot of NGOs, but we made a lot of mistakes, but anyway, that's how Partisan Health was born. And we always had big aspirations as young people do, and we thought, we don't want this is not only about Haiti, it's about the United States, poor people facing both poverty and disease in the United States. So we were thinking big enough to, go big or go home or whatever, back when I was in medical school, and Todd was in graduate school also up here.